السلام عليكم ورحمة الله. بسم الله الرحمن الرحيم. My name is Dr. Taha. Today I want to show how to insert the laryngeal mask in the prone position. In many surgeries you may use laryngeal mask in prone position, and this is totally normal. The ventilation is very good, and mechanics of the lung is working good with the laryngeal mask in prone position. The technique make the patient flip himself before the induction, so the patient help himself. This is shortening the time, so the time, because flipping the patient take a long time. And also, it looks more safe that the patient flip himself, adjusts his pressure point. All pressure point can be adjusted by the patient himself. He see if there is pressure on the breast, in the genitalia, in the hands. So the patient can adjust his pressure point while he's still awake. Successful insertion, the most important point, that the patient puts the head as a side he likes, either right or left. Second, we put the tip of the laryngeal mask between the teeth, or at maximum as the patient can tolerate. So put the laryngeal mask before induction of anesthesia. And in the mouth, as maximum at the depths, as maximum as we can, without the patient starting gag. So we put it just 1 or 2 centimeters, just at the tip of the tongue. And after patient falls asleep, we push the laryngeal mask in backward. Okay. There is one important precaution. We put the laryngeal mask first while the patient is awake. Don't try to do induction, then insert the laryngeal mask. It will be very, very difficult to be inserted after putting the patient to sleep. So put the tip of the laryngeal mask, because of this allowing the patient to open his mouth. So it's easy, in the second step, just to push it inside. But the problem with this technique, that pre-oxygenation is interrupted, so it's not be adequate. So this technique of insertion of laryngeal mask in the prone position should not be performed in a patient who are cannot tolerate hypoxia with induction. So any patient you want to pre-oxygenation is mandatory in this patient. So in this patient you have to do it, insert laryngeal mask in supine position as usual. But if the patient can tolerate a slight apnea, or can tolerate the slight hypoxia with induction, you can perform this technique. You can insert the laryngeal mask in prone. So patient, for example, have a cardiac problem. In this patient, no, I'll insert the laryngeal mask in supine position. Okay, then I tell the patient. But normal patient, as the patient will see now, young age, there's no risk even with apnea, so we can do induction, because interruption of pre-oxygenation will not markedly affect his condition. He can tolerate interruption of pre-oxygenation. The precaution of this technique is just to keep the trolley of the patient beside the operating table. So in the case you fail to insert the laryngeal mask adequately, or the ventilation is not adequate, you can flip the patient in supine position and reinsert the laryngeal mask in supine as normal. However, this is not occurred in less than 2% of cases. This very rare to happen. However, you should keep always the trolley available for if the laryngeal mask failed, or ventilation of the laryngeal mask is failed, or any problem happen, you can bring the patient to supine position and adjust. But as I said, this is very rare. Okay. Take video, okay?
Yes.
Okay.
Exactly.
So start with putting this laryngeal mask inside. Put it inside. Okay, that's it. Enough. Okay. Then we'll start induction in this position. You just give fentanyl. Okay. You sleep now, brother. Sweet dreams. Okay. As noting that we are keeping the trolley here all through, so at any problem we just can flip him back. Sweet dreams. Yalla. Okay. Once the patient fell asleep, we will push this laryngeal mask inside. Okay, and we just push it inside. Then we connect. Perfect. Then that's it. We start mechanical ventilation. Okay. We inflate it first. For just a second. Okay, so this takes 1700. By pressure support 13, so I can decrease the mechanical ventilation, and I can adjust my parameters. As you can see, now he's taking about 655 with pressure support 11. In short duration surgery, you can keep the head of the patient to one side, but if long duration, you can adjust the patient head with the certain support. But this needs the chest to be higher than this level. This is intraoperative.
Okay. Suresh, give the plate 15, my dear.
You accept to put this video on the internet and I teach you video for doctors, okay?
I accept. Thank you very much
Thank
for
you
this
so much.
opportunity.
Yeah,